I worked previously at another brand that really exploded the NAD plus at-home therapy market using home injection kits at home. And I think we really entered the market at exactly the right time as the birth of the GLP-1 sort of uptake happened simultaneously. So the attitude towards injecting at home completely shifted. And what I found in industry was that people began to compromise manufacturing, favor cheaper manufacturing or cheaper materials in order to increase margins. And that didn't really sit as that well with me. So the birth of BIO ATELIER came between myself and Mila and the concept of improving the manufacturing standards as well as improving access to the wider consumer market. And then Mila, my co-founder, do you want to introduce yourself?
Hi there, so I'm Mila Reeves. Delighted to be here, so thanks for having us. My background is actually law, so I'm not a scientist or a doctor, but I understood the importance of compliance and regulations. So when I met with Trinity, who was saying, let's raise the level here, let's raise the benchmark in this space, I was delighted to do that. I was already commercially advising some of the world's best longevity institutions. So I was noticing the trend towards NAD and other longevity molecules. So I was very excited to set up this company with Trinity.
And Tony? Do you want to say a little bit?
Yeah, I'll give a brief introduction. Hi, everyone. My name is Dr. Tony Banerjee. I'm a doctor by background. I've been a doctor now for about 25 years. My kind of background is, I guess, as a private GP. I had a Holly Street clinic that did aesthetics and wellness. And we started off in the longevity sector when it really first started. So we've been involved as medical advisors and medical infrastructure providers to the longevity industry and the further clinics and hospitals for about 10 years now. And really pleased to be advising BIO ATELIER.
We love having you on board as well. So Deb, do you want to take us to slide 2? And I think this is really an explanation of what Mila touched on as well, which is first and foremost, we aren't scientists, we aren't researchers, we are consumers, and we're wanting to lift the standards on what the consumer has access to and setting a benchmark in longevity supplements to enable the consumer to restore energy, clarity, and vitality. And that's really our sort of hero product with the NAD therapy, but our eyes are very much fixed on what's going to be next and what can improve the wider longevity market, always looking at our most pure formulation. Our supplements as well, which we'll touch on further into the presentation, is the only Informed Sport certified NAD plus supplement. And whilst injections sit outside of that, they can't have that certification. I'm very confident that if they did, we would have that certification there as well.
Yeah. In the world, I might add, sorry.
In the world, yes, in the world. And again, our mission is to look at the wider competitive market and to not consider the NAD market as our competition, but so much your biology. And that's where the roots of our foundation and our formulations come in. Mila, do you want to touch a bit more on that?
Well, I was just saying, you can take the same supplement, but how it affects myself, Trinity, and Tony will be very, very different, right? Our DNA is different, our lifestyles are different. So, and even on a certain day, we've noticed that somebody may take it and it may alleviate brain fog. Another day it will alleviate jet lag, for example. So it is very much working with your biology, which then does fit into that trend of personalized longevity and medicine, really.
Deb, do you want to?
Healthcare. Yeah. Okay. So this is me. So why is everyone talking about NAD? You know what? It's a funny one because actually NAD is literally life's power source. It's in every single living organism, and we are born with it. And I think the reason we're starting to see it everywhere is because of marketing. And because the environment has changed around us. I mean, I don't know about you, but I think modern life has become biologically expensive. We're literally living through a period of unprecedented cognitive demand, chronic stress, lack of sleep, and metabolic pressure. I think even the WHO now classifies burnout as an occupational phenomenon, and rates of metabolic dysfunction and insulin resilience continues climbing globally. So I think consumers are no longer asking, how do I live longer? but how do I live better today? How do I maintain energy, clarity, resilience, and recovery while functioning? And that's really where we believe the NAD conversation has accelerated. And at the same time, the entire longevity economy itself is exploding. Look at the rise of biohacking. So I think it's a very exciting NAD conversation, and it's being amplified all the time with social media, which is great for us. I think it's really, really great.
Absolutely.
Fantastic. So I'm going to talk to you guys a little bit about the hype versus the reality. Look, I think there's no secret that the longevity industry has got a lot of science behind it, but it's also got some fads as well. And I think that it really plays into this sort of personalized optimization. I like to call it, rather than longevity. As Milo and Trinity said, there isn't a one size fits all about this. And I think what we've seen, particularly post-COVID, is an increase in people certainly talking about fatigue. I think there's a real fatigue epidemic, and burnout is for real. You know, I have personal and professional experience of dealing with this. And I think that there's a lot to be said for us all being a bit more, personalized rather than mainstream about how we go about it. There's now a performance culture. I describe it as like a hustle culture as well, that everyone's trying to be, wanting to be busy, wanting to be on top, form the whole time. And I think that creates a problem. I think that our bodies aren't designed to do so. And so when you look at the reason why there is hype, it's because we all want to be a better version of ourselves. And how can we do that? Well, I think whatever we do, there has to be some kind of clinical involvement, but also some evidence base to it. I think, what are we doing in healthcare if we're not dealing with evidence base and science? And you'll say to me that, well, look, a lot of these things are quite new interventions. How do we make sure that what we're taking is real? Yeah, I'd agree. But I think NAD Plus has been around forever. And I think that there is research into it over the last 10 years. But that doesn't mean that it's a fad product. We're seeing a lot of people who have been using NAD Plus as part of their daily routine, weekly routine, whether it's IVs, whether it's at-home supplements, whether it's the injectable pens, and really finding a huge benefit in their symptoms of tiredness and the symptoms of brain fog. And really what this lends itself to is a shift away from the traditional sick care model, where we wait for us to have the illness or the heart problem or the stroke. And actually what we're doing a long way before that now is preventative medicine. And we're very much focused on that. So what we wanted to talk about in this session is obviously the foundation about what NAD Plus does. I'm not going to give a big scientific lecture on it. I don't think we need to, but just for you to have a general idea about what it actually is and what it does. Then we're going to talk about the different modalities, so taking it as a pill versus taking it as an injection versus taking it as a pen. And we also want to talk a bit about why does it feel that many products seem to underdeliver, as well as what's actually impacting outcomes. Then a little bit about why you would choose BIO ATELIER as the brand for your products, and then also the application both from a clinic perspective and a consumer perspective as well. Okay, so again, NAD Plus is something which we learned about, in first year of medical school in our biochemistry. And what we know about it is that it's a naturally occurring coenzyme. We know that it's in every cell of the body, as Mila said. We know that it's absolutely fundamental when you're talking about mitochondrial function, when you're talking about cellular energy. When you're looking at DNA repair, how the body repairs itself, and also so many metabolic processes. What we do know is that we're all born with NAD plus, and over a period of time that NAD plus deteriorates, or should I say depletes. And that can be, partly by age, partly by illness, partly by medications that we take, partly by stress levels. So it's really important that when we're looking at this, that we're not just looking at one isolated aspect of your health. We have to look at the global picture and see how we can best optimize you. Next slide, please. So as I said, there's a decline in NAD plus, which, as if you know the science behind it, it reduces ATP, and then what you end up with is this problem of chronic fatigue, You feel like you haven't got the stamina or the endurance, and plus your recovery's slower. I think we've all had times in our life where we felt that we recover quickly, and as you get older, part of this is the fact that the NAD is depleting. There are other variables, of course, as well, and the fact that our cells are repairing in a more impaired way, that for me is the crux here. That how can we improve the way that our cells repair themselves when under stress? All right, so this is a bit more about the science, but really what NAD does in a nutshell is it really pushes from the mitochondria, drives the cellular energy. So what it does, it gives you clarity, it gives you increased performance, overall vitality improves, but as I said, it improves the kind of DNA repair as well as reducing oxidative stress, which is the main thing that affects our resilience. It also enhances brain function. So we know that if you take NAD plus on a regular basis, I can speak from personal, kind of experience as well, that it actually, it actually really improves your brain fog. I had long COVID back in March 2020. I fell really ill with it, and I only really noticed the brain fog getting better when I went on to NAD plus regularly. And then look, why do NAD levels decline? So I've already touched upon this, really. So part of it's the aging process, part of it's your levels of stress, and we all have an equilibrium, that we kind of work to, and everyone's different. As the lady said, what works for me may work differently for Trinity, work differently for Mila. So it's really important that we understand what our stresses are, and that we look at that as part of the overall lifestyle modification. Poor sleep, I think that if I was to say one aspect of longevity, which I hit home with every single client, is that you have to get your sleep right. And I say this myself, there have been times when I've been very good sleep and times when I've not been. What we do know is that poor sleep really does contribute to NAD levels declining, as well as your lifestyle. So the sort of, kind of drinking, kind of culture as well, that not only affects your body from the alcohol point of view, but also the choices that you make during that time. So what you're eating, your sleep suffers as a result, all leading to this metabolic strain that causes our NAD levels to decline. Yeah, and why do most products fail? I think that taking what I was saying about there being lots of kind of fads in the industry. There's obviously various factors that affect this, one of which is poor formulation. So obviously going to a reputable manufacturer, who sources the products, in a kind of ethical way, that's the most important thing that you can do as a consumer. Cheap is usually cheap for a reason. And it's very difficult, I know, for a lot of people to maintain an interest in the industry, because what tends to happen is that we tend to plateau with the results that we get, or we run out of money. And so I can understand why people often go for the cheaper brands, but unfortunately that usually means that they're not as efficacious. And so it's really important that you consider that when you're buying a product. There's also the obvious thing with bioavailability. So if you look at from like any way that a molecule or a medication can be taken. It can be taken orally. It can be taken as a kind of transdermally. It can be taken subcutaneously. It can be taken intravenously. And in that order, you find that you get a better bioavailability from that. And of course, with that, the prices increase, but it depends on what your budget is and what your goals are. And that's the most important thing here as well, is that, whenever we see a new client, we sit with them and make sure we go through their goals and ensure that they're on the right product for them that suits them on a kind of health level, of course, but also suits their budget. There's no point in just having one IV treatment and then not being able to afford another one for a year. So this is the way that we need to think about this, and I think there's a lot of misunderstanding in the industry as well. So it's really important for us to make sure that people are as well versed, and I always say that a well-educated patient leads to an empowered patient, and then that leads to trust in the brand as well.
Totally agree. Deb, do you want to go next slide?
Yeah.
Perfect. So if you're looking here, these are the three modalities or level administrations that we have at BIO Atelier. We have our capsule, which is a 500 milligram enterically coated liposomal capsule. So it's largely known, widely known, that NAD plus unaided is fairly useless when ingested. And that is why at BIO Atelier we do that. We aid the molecule itself by ensuring that it's liposomally coated. That liposome, it's a fatty lipid. It's going to mimic your cell membrane and ensure that we get plasma uptake, cellular uptake as well. We also enterically coat the capsule, meaning that it's stomach acid resistant. What we don't need is the capsule going in and just completely degrading, which unfortunately a lot of supplements do. They're not doing permeability studies. They're not looking at the efficacy of the capsule outside of product in capsule, job done. Whereas we're going further and looking at how you're going to actually have the uptake and therefore the clinical or therapeutic benefit. At BIO Atelier, that is our primary driving force, is that the end consumer has a therapeutic outcome that is meaningful, ideally profound. And then we have the injections. So this is our vial here. It's 1,000 milligrams of NAD plus, and it is in a 5 ml vial. This is suitable for practitioners and home users. So there's 20 microdoses or 50 milligrams in this vial here, which is a multi-use vial, meaning it can be used by practitioners across multiple patients or by a single user for multiple injections. So this is a super flexible vial, and it comes either as a kit with syringes and all the application that you need, as well as sharps, disposal. It's a mannitol-free formulation. Now, what that means is it's made without, in the lyophilization process, without a sugar-based bulking agent within the lyophilization process. This is not something that manufacturers have to declare because it's part of the manufacturing process. But what we found out about glucose is that it actually can restrict the cell membrane and make cellular uptake more limited. So by taking the mannitol out, again, we're improving bioavailability. Above that, our formulation is done in GMP certified qualified lab. So it's a certified batch verified GMP production. It also has obviously pharmaceutical grade, and it's a super useful product. And then the pen. This is the one that, Phil, I'm going to drag you into a demo. This is a super consumer friendly device. It's a multi-use delivery system, much like a GLP-1 or an insulin delivery system, where the dosage is loaded on the end, a simple, very small, superficial syringes inserted on the end, and the dosing is appropriate. Really precise, but super effective for a consumer, because if you don't like the needle, you can put the lid on and disguise it. But if you're not too bothered, you can simply just, use the injection pen for simplicity, and then replace that lid. We supply it with this kit here for your first use. So you've got the kit, the chill pack to keep it cold, and then you can just keep that in the fridge. So again, it's free from contaminants as well. Dev, do you want to move on to the next one? Oh, this is Phil. And we're going live, lady.
Okay,
guys,
well,
this can all go wrong.
Unaccustomed as I am to doing live demos, so just responding to what you were saying there, Trinity, this is my pen. And obviously I've got the capsule already preloaded in here. So you can see my supplies down to there now. And what comes in the kit, as you can see, is the injectable tip. So you can see there's a protective sleeve that I've taken off there. And what I need to do is just screw that in to the end, which then gives me the ability to pull that off. And you can see that likewise, there's another protective cap over the top there. So I don't know whether this is right or not, but this is the way I do it at home. So I push the pen back over the top, which exposes, as you can see there, the little tip. So then what I do is I prepare myself to receive. So in the pack, you get these alcohol wipes. So off that comes.
And
so
we
now
sell these in 10 doses or 20 doses, which is 500 milligrams or 20 milligrams. So you get the sufficient number of syringes and wipes depending on the dosing that you choose.
Yeah. So what I need to do is I'm just going to stand up.
Expose your abdomen.
There we go. So you can see, I'm just going to clean the site there, ready to go. And so what I need to do is I need to wind up the injector pen to the right level. So I take this up to 25. Is that right, Trinity?
Yep, perfect. That's 50 milligrams of NAD. So
yep.
There's 500 milligrams in 2.5 ml.
So you can see that's in there. So I take the tip off, which obviously exposes the the injector pen at the end, and then squeeze, and away we go. So I feel just a very slight prick on my skin there, and we're done. So yeah, thanks for watching, everybody.
Nicely done, Phil.
Couldn't be easier.
Yeah,
And then,
just responding to what you were saying, Trinity, I mean, it's very interesting for me as a user because I've never self-injected, and I did have a little bit of a kind of, I'm going to be doing this by myself for the first time, but it was actually really easy.
Ah, good. Yeah, I always say once you get over the hump of the first time, then you're off and flying.
Yeah, perfect. Right, back to you guys.
Thank you. So we've got the 2 QR codes now on the screen, and one is directly for consumers that'll take you to our shop, and we have an exclusive 20% code for those who want to uptake and purchase the product to try themselves, which is longevity 20. Add that as their at checkout. And then we've got for stockists as well. So if you want to become a retail partner, you're interested in stocking BIO Atelier, then you can scan that QR code and that'll take you to our Access Practitioner page where you can put in all your details to become a retail partner of ours. And then the next slide.
I think that's you.
It's me.
Yeah, okay.
Is this me, Trinity? Sorry.
I don't know. Is that me or you? You can take it. I don't mind. Oh, is this me? This might be me.
I think it's you.
Yeah.
Okay, it's me. So the delivery method. So as I touched earlier, so what impacts the outcome? So the delivery method, we've got those 3 modalities. So we've got the injection, which is super flexible. We've got the auto injector bio pen, so that's super consumer friendly, and we also have the supplements. So it influences how your body takes up the supplement. And I think what Tony touched on as well is the delivery method isn't just about what you can access right now; it's what you can access continually to enable you to have the most sort of influential outcome along a particular protocol. So consistent use and using the product for optimal results that suits you. So if that's our capsule daily, it's 500 milligrams. So it is a higher dose. We're allowing for some of that product to be lost in the process that we're asking it to go through. But then the absorption as well. So the effective absorption for the NAD plus needs to be properly utilized by the cell. And that's why we take that mannitol out of our injectable supplement. User adherence, again, those long-term outcomes influenced by how practical it is to continue with the product. So if that's a supplement, if you say, well, I could only see myself injecting occasionally, then the pen with the 10 doses, you might find that lasts you longer and you can support with the supplement in between. And I think, Tony, you'd agree with any sort of supplement regime, cycling that is really important as well.
Absolutely right.
And then the purity, we go above and beyond to make sure that our product is as high a quality as possible. So we're not looking at just compounding this product, buying NAD powder from Switzerland or China and compounding and mixing it. We're actually deriving the NAD in our lab from the organic sources with using an enzymatic process to make sure that we've got one that matches your biology. We use a free acid NAD so that we can try and match your identical, be bioidentical and have maximum outcome. Do you want to talk about patients, Tony, given that you access patients all the time?
Absolutely fine. So look, I think I touched upon it earlier.
I feel like we've touched on this.
There's a huge number of patients now who are finding, as we're getting busier, traveling more, getting more sort of, looking at our laptops and tablets and mobiles all the time. We're not sleeping properly. There are so many variables that affect how, our energy depletes. I think it's really important to look at a product like this, which can, I should say, as part of a wider, protocol, address problems with energy, your recovery, brain fog, stress, and also help us age healthier and better.
Absolutely agree.
And look, I think that when you're sourcing any NAD solution, of course, BIO Atelier is a product, and there are lots of kind of people out there who are trying to get into the market. I think what you have to look for first and foremost is where the product is sourced from. Any good manufacturer and vendor should be able to tell you information about where the product is sourced.
We should be able to allow access to their COA, their certificate of analysis, which we always do. Absolutely.
So that's very, very important. The way in which the NAD is delivered, we've touched upon. Obviously, there are varying, ways to do that, depending on what the client is looking for, whether they're very needle phobic, of course, then of course, they do have to think about other options, but we have to make sure that that's personalized for the client. We obviously have to make sure that the clinic or the practitioner who is buying the product has the relevant support and training, that they can use the product on their clients with trust, and also know that there's some ethical framework to what they're doing, and be very transparent. I think that we always welcome people asking questions. We welcome people, coming in and sitting with us and looking at the products and talking to us more about it, because the only way that you'll feel comfortable is if the person who's delivering it feels comfortable, and you get that very, very easily. So always look for those things, and the ease of use. I think we've just seen from the live demo that the pen is a very straightforward way to use. Now, some people are very put off by using a needle, and I understand that. I'll probably put myself in that. Despite being very good at injecting people, taking an injection myself was a new experience. And once you start doing it, it really isn't painful. You might get a little bit of a sting, when you use the needle, but apart from that, it goes in very easily. And once you're over that, then you've got the whole sort of kind of long-term use of it. And I think as long as you're varying where you're injecting it, then you should be fine.
No, I think it's very much where the space becomes really interesting, the future NAD. I think the future of longevity will not be about just the one molecule, one protocol, or one miracle product. And certainly we've got our eye on other longevity molecules. I do think it's going to become even more personalized, because as we've touched upon a few times, different people have different biological demands, different lifestyles, but also different recovery capabilities and also different goals. So I think we'll move away from generic optimization and much more towards that contextual care. We're also seeing healthcare shift from reactive medicine toward preventative resilience, not simply treating disease once something breaks, but supporting energy, recovery, cognition, and long-term function earlier. Regarding delivery systems, we've just touched on the ones that we cover. They're not mutually exclusive. I mean, personally, I will cycle on and off. So I'll inject a couple of times a week and then take the capsules the rest of the week. Yeah. So it really depends on somebody's lifestyle. So when I'm traveling, I'll definitely throw those supplements in my bag. If I'm going longer than a weekend, I'll probably take my pen with me. But those delivery systems are becoming more and more intelligent, and we're keeping an eye on that and making sure we're at the fore of that, as they will evolve significantly. But adherence matters. And we don't want people, if they're needle phobic, to kind of insist on that. Take the capsules, they really work. It's far better that you are consistently taking something rather than kind of just intermittently doing something. It's the same as, going to a longevity resort, right? And going and resetting and doing your fasting there for a week and then coming back and not doing anything for the rest of the week. Adherence is key. And I know consumers are definitely becoming far more educated, but that said, I think they're being bombarded more. So I think they need to continue asking harder questions around sourcing, manufacturing, purity, stability, and evidence. Going back to our purity, for example, the mannitol that we've talked about, if you're taking other versions of NAD or other brands NAD, one of the reasons you won't see mannitol listed there is because it's not an ingredient, right? It's part of that manufacturing process. So I think it's really important to find out, if you're ingesting something or injecting, ask more. Where is your NAD coming from? How is it being stored? Is it being third-party batch tested? All of these things, because ultimately they're going into your body. So I think the consumer is beginning to ask harder questions and should continue to do so.
I think so, yeah. I'm just definitely looking at some of the questions coming in.
Yeah.
I'm seeing.
And I think it's healthy for the industry as well, right?
Absolutely.
So yeah, I think we have the next slide. Oh, the vinyl takeaways over already.
I think we've done that. Yeah, I think
we've pretty much done it. I mean, yeah, longevity is not about chasing perfection in a longer life. We need to live for today and think about tomorrow, because those habits that we instill now will determine how we live, in our later years. And it definitely isn't about managing decline. And when you have something like Pure NAD to put into your system and support your recovery and your resilience, I think that's really meaningful. Does anybody want to add something? I do want to say we wanted this session to feel practical rather than theoretical. I hope we've succeeded on that.
Yeah, I hope so.
Yeah, and we hope that the people listening are leaving with understanding more clearly what NAD is, what it can do for them personally, and also how they might be able to implement that into their existing clinics and services.
Great.
So we can open up now.
Yeah, obviously we've got some questions, guys, which is very
let's
exciting.
have a look.
So the first question came through and asked me, when do I feel the benefits? So as I was speaking with you guys, I mean, I genuinely did feel an uplift in my energy levels, which was really encouraging. I can't really quite remember when that was, but I definitely felt, wow, that's a thing. Some of my normal fatigue issues are definitely not there. But the question that relates to that is, where can we buy the products and trust that it's the real thing? If somebody lives in the UK, and obviously we've got a very international audience, it's difficult to know where to trust. So I guess the question is that the guys can buy directly from you, or is it?
Yeah, absolutely. So we partner with clinics as well. So clinical partners we're open to as well. So we always will guide someone if they're looking at personalized advice, because that's one thing that we're really passionate about. So if they want to visit a local clinic, we have partners throughout London where you can access either one of our IV products. You can purchase a kit, a take-home kit, speak to a practitioner about how this is going to benefit you in terms of experiencing the product and how quickly it will work. Is that what you mean, Phil? When can you feel the benefit?
Yeah, that was the question.
Yeah. So because it's entering your bloodstream, people feel an uplift almost immediately. We can almost get sometimes a jittery feeling. Certainly if anyone's had an IV, they might have been quite uncomfortable during that experience. All of our products are designed to be much more consumer friendly in that by using a microdosing protocol, particularly with the home kits, it's little and often. So your body doesn't have to metabolize and take on huge volumes in order to have or try to expect a residual result. You can do little and often so that you can be topping up those supplies. And we would do a 3-day loading dose. And I would say a lot of our patients, if not above 90% of our customers, report in those 3 days significant improvements, be that in sleep, HRV, REM, cognitive improvement, general daily fatigue or brain fog, recovery, either athletic or cognitive. So we've got anywhere from CEOs in the boardroom down to high-performing athletes to busy parents who say, instead of reaching for that 3 p.m. espresso or that coffee or having that crash, I feel a sustained energy, a sustained balance rather than chasing a caffeine high or chasing or expecting an energy dip. So that's really exciting to us. That's what motivates us, definitely.
Yeah, and of course the thing I didn't mention about when I was doing the demo is that you mentioned the 3-day preload, but it's then every other day that I take the injection, right?
Exactly. So that's for the kit to do sort of a month's supply. That would be our guideline. It's a microdosing protocol. It's very widely used now. It was very much first ever used with my previous brand that we worked with. But now it's pretty much the same protocol that's been adopted by all the brands that you see out there now. And it's getting crowded, and it's getting really hard to determine who's actually doing this with integrity. And ultimately for us, the molecule's integrity is most important. And one thing that people will understand about NAD or may not understand is that it's a very unstable molecule. And that's why the early science led to NMN, NR, because it was a much more stable and much more bioavailable in terms of oral digestion, certainly using those precursors. And it's a question we get a lot, and I'm sure it's there. I think I have seen it here, is why not NMN or NR? And this is really going to come down to the direct flight concept. If you're going to take a direct flight, you're guaranteed to get to your destination. If you're taking a connecting flight, if there's any disruption in that first port, then you are relying on your body to have other enzymatic processes working efficiently. And if you're NAD deficient, it's quite likely, particularly in age decline, that there's going to be deficiencies in that pathway as well. So you're not going to necessarily be guaranteed to get to your destination. And we know that there's tissue in the body that has a connection that enables NAD to pass freely within it. So, but going directly to the source of NAD, if you're looking to drive your NAD plus levels higher, then direct NAD therapy is going to be the most efficient way of doing that.
Okay, great. Well, question about research. So what published research exists about the BIO ATELIER products to share their efficacy?
So we really do stand on the shoulders of giants and the research that already exists. It's an emerging science. If we wait for all of the clinical evidence and clinical trials to catch up, we're not going to have a product on the market. But we do, for our supplements, look at all the third-party testing and product quality testing that we can do. We've done a test, and Marla can touch on that as well with our supplement, with an independent study that was done. And we also quote a lot of Professor Ross Grant and Dr. Nadie Brady, who are two Australian research scientists who publish a lot of really meaningful data around NAD plus therapy, direct NAD, either intravenous, subcutaneous therapy, and it's incredibly meaningful research. And I'm happy to share those links with people who might want to go deeper into that research.
Yeah, great. Well, we can obviously share some of that with the audience.
We can add a page to this to anyone who wants to have this this presentation perhaps in their inbox. We can add to that a lot of research around the values of using NAD therapy. No problem.
And those stats, just really, really quickly, we did do an independent study, completely impartial. In fact, I even asked them if they could reframe some of the stats, and they said absolutely not. And after this 30-day study with the House of Hormones, 76% reported improved energy, 72% reported improved mood, and 70% felt better to handle daily life and stress. So we're really, really pleased with those results. We were told they were stellar results, actually. And as I say, completely independent.
Yeah, that sounds excellent. So,
random and independent, yeah.
Trinity, you were talking about the connecting flight or the direct flight. So there's a question about the per milligram. What percentage becomes bioavailable per delivery method between the capsule and the pen?
That's a really good question, actually, and that's something that we're looking at studying a little bit more in terms of the nanomoles that actually access the bloodstream. There was a really interesting study that was done throughout an infusion, and I think it was 3 nanomoles that were being administered per minute. And when a test was done within 2 hours of the infusion, it looked like there was almost 99% uptake, because what they were seeing visibly still in the plasma was significantly less than what had been done over 72,000 nanomoles that had been administered in that time. And it doesn't just disappear. So that's going to be cellular uptake. So we're allowing for degradation. The pharmacist that we work with the supplement, this took 18 months and several PhDs to formulate. This wasn't something that was just like, hey, can you make us some NAD? It was a long process, and one that they're incredibly proud of. And this is a pharmacologist or a nanopharmacist who's been using liposomes to deliver chemotherapy drugs. So he's very confident in his liposomal technology. It was just the first time they'd applied it to a nutraceutical. So we were really excited to team up with them to produce the NAD+. And he would be mortified if I said there was less than 60% uptake in the bioavailability and the permeability of our NAD+ supplement. So you're talking about a 500 milligram supplement, enabling you to have up to 250 milligrams of NAD a day. Now, what I've seen in other research was that your body can consume and use up to 600 milligrams of NAD a day. And it's slightly different in terms of the nanomoles in plasma and things, but that's research and science that even I am trying to dissect. So even a small uplift continuously is going to enable you to come out of maybe what would be considered NAD deficiency. But if we're looking at optimizing and maximizing, then you can do that with greater volumes as well.
Gotcha. So Reynolds asked a question, which I think we'll do at the end because it's more of a next wave product discussion. Somebody's asked, what is the dating on the vial pen? Which I guess is probably a question related to shelf life.
Yeah. So when we produce with a 1-year shelf life. So our product, so NAD in liquid formulation, and I saw a question there around sublingual administration, and NAD being unstable in liquid formation meant that, again, there's rigorous manufacturing techniques that we use, patented techniques that we use in order to ensure that we produce this NAD to the highest quality and with a shelf life that can minimize degradation. So that means we respect the 4 pillars that can affect NAD in production. So that's going to be light. So you can see it's tinted glass, and we have the lid that we keep on the pen to protect it from light. That's oxygen. So we minimize any oxygen in production. There's very small, if any, air bubble in our cartridges when they're produced. And the headspace in our vial is actually removed of oxygen and put in with a slightly different, like hydroxy application in there. So we're removing so we deoxygenate the vial. We then ensure the pH is ensuring its stability as well. So we've got pH, light, temperature, so 2 to 8 degrees for storage, and we have cold chain as well. When we ship with a chill pack as well. So we do all of that in formulation.
Just wanted to add to that, the pen itself is multi-use. So it's just the cartridge or the vials that have that expiry date.
The pen can last forever.
Exactly. Yeah. And we are looking at other cartridges as well, but that's for another time. So yeah, it's a multi-use pen, which is great.
Great. And I guess probably the killer question is how does your product compare to NR and NMN, which I guess is probably what a lot of people thinking at the moment.
Yeah, and I think that's what I touched on earlier with that direct flight. We're relying on another process in order. If your end goal is to increase your NAD plus levels, then you're asking your body to go through another enzymatic process, which can create an NAD deficiency in order to do that. And NMN also would require another conversion in which to cross the cell barrier anyway. So it's not as simple as just using one or the other. There's a supporting research across all modalities, and we support all of it. But really, if your end goal is NAD plus, in our opinion, the research that we love and support really does say that direct flight can get you there faster. Yeah,
and I guess it's kind of like side-by-side studies and things like that you'll plan in the future. But there's another related question to that, which is about assessing dosage. And what are your thoughts on safety studies?
Deb, Tony, do you want to touch on that, or do you want me to?
You can. I mean, what I was going to say was this is not a. What we don't have is years and years of research to say that what is. So this is an evolving process, I guess, is what I'm trying to say clumsily. What we're seeing today, is the start of trials, but what we haven't got to is a place where we can say for sure what is safe and what is unsafe. What I would advise clients to do is to do as part of a medical protocol. So go to a clinic, go to a doctor, have some medical oversight over what's happening, and then you'll be on the right dose for you. But what we can't say is that it's certainly not a one size fits all.
No, but without consumer facing product, that's why it is such a low dose. So it's very much a micro dosing, really safe kind of protocol that's very widely used. It's not a significant volume in one go, like when you're having an IV where 250, 500 or 1,000 milligrams is administered in one foul swoop, and can lead to quite strong adverse reactions or certainly immediate responses. So we've minimized the dose to make it a very safe protocol. But as Tony says, if you have a challenging medical history, or you're trying to drive a particular outcome, this is why our medical board exists across metabolic health, female health, MSK doctors, brain health. Yeah. We've even had a conversation with a leading oncologist who wants to look at our product in greater depth around his work. So we are really excited about the science. Bring it to us. We would love it. We really do.
And I guess a question about US deliveries, because one of the questions I have in my mind is availability and where you guys are shipping. So this is relating to the US. So first of all, do you ship to the US at the moment?
We do. We ship internationally. What we're finding is regulation is constantly changing. The framework's changing at the moment with the MAHA movement and what's happening at the moment in the US. And each regulation in each state is slightly different. So yes, we can get the product to the US. I also saw the question there about if the solution's pre-mixed or needs reconstitution. It doesn't. It's a pre-mixed product. So there's certainly the 1,000 milligram vial. If you're using the lyophilized NAD+, which we do have available for practitioners, please fill in that form and you'll get a brochure on all the different products that we do that are exclusive to practitioners. We've kind of just touched on this in terms of what practitioners can use and what's more consumer facing for them.
Yeah, and I guess just to sort of dig into that a little bit, Trinity. So there are practitioner grade products and consumer grade products. You're operating both channels at the moment. Is that correct?
Yeah, absolutely.
Okay, great. And
keeping up with consumer demand by allowing practitioners to have access to the product as well. And then, that partner, that trust is so important. So having a practitioner who you trust that says, I think that from your testing or if your epigenetics or, whatever they're looking at, then they can come with quality assurance to us if they're looking at introducing an NAD+ supplement.
Yeah, great. So I guess a similar question that's come in about clinical data, and I guess this is ahead of the studies. I mean, so much of the longevity field is, new products that are, GRAS categorized, but likewise moving into studies. Is it not difficult to compare to precursor-based formulations without placebo effects?
Yeah, I mean, absolutely. That's something which I would say exists with any treatment.
I was just going to say the same thing.
What I think is probably a more important question is whichever route you go down. This isn't just, oh, I'll take it once and it's going to work. This is like with any sort of training, whether it's physical training, whether it's brain training, everything is about consistency. So whatever, product, that's why I was saying the medical oversight is important, because if you have somebody who's looking after that, rather like a personal trainer would look after you in the gym, then what you get is that consistency, and you know that will stand you in better stead than, okay, today I'll try sublingual, tomorrow I'll try an injection, the day after I'll try subcut. It just doesn't really work like that. It's all about the consistency.
Yeah, and I guess one last question, which I think you already answered, Trinity, which is how can you ensure stability without cold packs when shipping to the USA? So I guess this is the cold chain you were talking about.
Exactly. And we're one of the only products on the market that has a stability report to ensure that we've done a controlled long-term in real-time stability report and accelerated stability report as well, to show that the rate of degradation is minimal if we take into consideration those 4 pillars I already mentioned: deoxygenate, protect the pH, temperature control, and protect from light as well. So the chill packs and the insulated cases that we deliver in will at least ensure room temperature for the time that it's traveling.
Great. Well, I guess there are no more questions, Myla, Trinity, and Tony. So thank you so much for joining us today.
Thanks for having us.
Yeah,
it's been fun. And of course, best of luck with the work that you're doing, and obviously, the mixture between the scientific work you're doing and the commercial drive behind the business. So yeah, brilliant. Thanks so much for joining us, everybody else as well today. And we'll send out those notes with those scientific links, Trinity, as well.
Yeah, I'll add a slide.
Wonderful.
Yes,
okay.
No problem.
Thanks.